The most commonly used agents for GI contrast studies include barium liquid and paste and iodine, as shown here. This is my cat Jackie, a female cat for our GI contrast study. Optimally, the patient should be fasted before the contrast study. Any feces or ingesta left in the intestines or colon could create a confusing artifact for the veterinarian. In addition to fasting the patient and administering a cleansing enema, it may be necessary to administer an oral stool softener or mineral oil. According to the textbook, the dose of barium that should be given is 4 to 8 mils per kg. So Jackie weighs 5 kg, so she would receive 20 to 40 mLs of barium. Most patients will tolerate being given the barium with the syringe, but sedation may be required. For the x-rays, we measure the patient while in the lateral and VD positions at the location of the last rib. For a GI contrast study, x-rays need to be taken at the baseline mark, meaning pre-barium, and right after the barium is given so we can get a clear view of the esophagus. Depending on the veterinarian, times may vary, but according to the text, you want an x-ray at the 15, 30, 60, and 90-minute times after the barium is given. After each x-ray, you want to be sure to label each x-ray with the appropriate time and date to ensure they do not get mixed up. Some contraindications of the GI contrast study would be if a patient is actively vomiting or regurgitating, if we know the patient has megaesophagus, if it is in a coma, and barium should not be used if a GI rupture is suspected. The study should end when the barium is in the colon.
Two.